Good evening. My name is Karen Matlock, and I'm here to talk to you about computer science and patient care. Computer science is one of the building blocks of nursing informatics. When utilizing computer science in nursing, it allows for data to be acquired and manipulated to generate information that is valuable to the growth and knowledge in the healthcare environment. This leads to an increase in safety and evidence-based practice. And here you can see the nursing informatics role and the different components of it: the computer science, nursing science, information science, and cognitive science. The clinical setting in which I practice is an emergency department in an urban teaching hospital in Rhode Island with a magnet designation. The hospital itself has 247 beds. The ER sees over 75,000 patients a year. And in the ER, we have 60 beds with 4 critical care rooms, a fast track section, and psychiatric holding beds. In the ER, we use a few different computers and with different hardware. We have the standard desktop computers found on desks. Others are attached to a wheeling desk for mobile access, which is the bottom picture I have here, and others are attached to walls in the patient rooms, which is the top picture. The computers we use have internal components that consist of a motherboard, a central processing unit, random access memory, a hard drive, power supply, a heatsink, and a read-only memory. External components of the computers at work are the monitor, keyboard, mouse, printers, and speakers. And I can even go on to say the scanners that we use for medications. Epic is the computer software that the hospital uses for all electronic health records. Epic at the hospital I've been working at has been in use for over 10 years, where we switched from MedHost before Epic. Globally, Epic is the most adapted electronic health record system in the world. One study shows that 89% of acute care hospitals use Epic in the United States, including large hospitals such as Johns Hopkins and Dana-Farber. The different applications within Epic are specific for different areas. The emergency department uses ASAP, oncology uses Beacons, Radiant has radiology, and OpTime is used for surgery. Epic Software Systems has multiple applications that aid in research, including Cosmos, Slice Dicer, and Chronicles. And within Epic, there's different modules, including MyChart, which provides a portal to patients and for electronic health records. Care Everywhere links other hospital systems to access records, and Healthy Planet helps providers monitor patient health trends. Epic in the emergency department has been tailored to our needs. It's designed to manage the unique patient flow of the ED. It has different triage capabilities. The ED trackboard includes acuity and patient location, which is unique to the emergency department. It also has various documentation narrators, such as code, stroke, critical event, trauma, and restraints. It has the abilities to do secure chat for non-urgent matters between providers, which reduces interruptions and improves workflow efficiency. It's like an instant message or texting. Nursing protocols are also built in with specific ones to the emergency department. Here is an example of the Epic code narrator, and it's done in real time. Emerging technologies that I see at work are the increased usage of a mobile ED access with the ASCOM phones and a new system called Dynamedics. The mobile ED access is something that's newer to the ED that we've been trying to have increased improvement on. There's multiple benefits to the ED ASCOM phones, and we're going to go over some of those. They increase the bedside charting. You could take the phone and chart as you're talking to the patient at the bedside. You can do a medication administration through scanning a patient's armband and the medication with the phones. For providers, photos can be taken and stored of the wounds and injuries with images uploaded into the electronic health record. You can secure chat and have phone abilities for improved communication between staff. And you also have ability on the phones to receive alerts for patients with aggressive behaviors, sepsis warnings, and infectious disease processes. It also allows direct access to drug reference applications in the palm of your hand. Dynamex is something that's exciting that just was really implemented at my ER recently. It's integrated into the Epic software. It combines a drug portal and a disease information portal into one and provides evidence-based practice guidelines. It has a sub-feature in it called Dyna AI, and the Dyna AI can be used by healthcare providers to ask AI detailed questions on clinical decision making. It does not replace clinical judgment, but harnesses the capabilities of AI with a strong focus on patient safety. Its purpose is to enhance the healthcare professionals by reducing the time spent searching for information and allowing them to devote more time to patient care and meaningful interactions. It also can be used as an app on the mobile phone with tutorial videos. And this is part of our Epic system where we can pull it up on the screen when we're with patient care. One thing that I see evolving in the future with the use of artificial intelligence is the triage model at the emergency department. For those not familiar with triage in the emergency department, it's the initial evaluation process used to determine the priority of a patient's treatments based on the seriousness of their symptoms and medical condition. This ensures that those who need urgent care are seen promptly, while patients with less critical issues are managed accordingly. In general, triage is done with the 5-level triage scales, relying on the subjective judgment of the triage nurse, which is inherently subject to variation both in the ED and among hospital systems due to a wide variety of influences like training, hospital policies, and experience of the triage nurse. My hospital has not started using AI for the triage process, but the technology and research is proving it to be beneficial to patient safety care. It's learning different algorithms to assess the severity of the patient conditions for prioritizing care in the emergency department. It has been shown to reduce patient times and improve outcomes. AI enhances the accuracy and efficiency of the triage process in emergency nursing. AI-powered triage systems help identify high-risk patients requiring immediate intervention. It allows for better allocation and more timely care by healthcare providers. By using AI to streamline triage, it does not trump a provider's judgment, but augments the provider's decision-making process. With the use of AI in triage, it has helped with interdisciplinary collaboration between emergency department and ICU teams that can connect critical care resources, which enhance the workflows and timely, effective treatment for severely ill patients. AI uses vital signs combined with a chief complaint and medical history to get the acuity from the triage process. And one model showed that it greatly reduced both under triage and over triage rates, improving clinical efficiency by over 27%. In conclusion, with all this technology, we're very fortunate, but it doesn't negate the need for human touch and empathy. These are nursing qualities that cannot be reproduced by a computer. Galatians 6:9-10 encourage us, let us not become weary in doing good, for at the proper time we will reap a harvest if we do not give up. Therefore, as we have opportunity, let's do good to all people. As Christ followers, the promise in Isaiah 40:10 says, so do not fear, for I am with you. Do not be dismayed, for I am your God. I will strengthen you and help you. I will uphold you with my righteous right hand. It gives the nurse hope in any situation, especially those that cannot be solved through technology. And please find my enclosed references. Have a wonderful night.